This is Namita Saitnotha for NEJM Catalyst. I'm speaking today with Sandra Andrews. Sandra is the Senior Vice President and Chief Operating Officer of Clinical Care at Providence. Providence is one of the largest nonprofit health systems in the country, providing clinical care across the West Coast. They operate 51 hospitals and more than 1,000 clinics extending from Alaska down to Orange County across to Texas. In her COO role, Sandy currently leads the Providence system-wide COVID-19 Emergency Response Operations Center. Providence cared for the first U.S. patient starting in January, and the Emergency Operations Command has been running since then. And while acknowledging that we are still very much in the midst of a surge, the focus of our conversation today is the preparations and the early experience of procuring, distributing, and administering the COVID vaccine to this first wave of healthcare workers. It is a milestone moment for sure, and we thank you for joining us today.
Thank you so much, Namita. I am happy to be here. It has been a whirlwind of a year, and even just this past week has us going in so many different directions, but very excited to be here where we have the vaccine in the arms of our caregivers.
Let's start with laying the groundwork that led up to these moments. When did your teams first start preparing for vaccination, and what did those preparations entail?
Well, all along, our motto has been that planning is the antidote to panic. And so we have been very purposeful in anticipating what's around the corner and strategizing that next move. We have had a COVID next team that's literally always that 90 days ahead going, what do we need to be thinking about? I remember early in the summer, we were planning flu and COVID intermixed. What does that look like? The COVID next team started planning in September for the vaccine with that expectation that this week would be here. And then, yes, we received on Monday that first dose.
And so we understand that we've all seen the videos of the first FedEx trucks leaving the Pfizer plants to distribute the vaccines to the state distribution centers. And the scale of supply chain logistics and coordination here is remarkable. Walk us a little bit through the vaccine getting there on Monday, and we're there, and then what happened from there on?
Right. Well, let me see. We can go in a lot of directions here, but let's start with, Pfizer is delivering doses in what they call these pizza boxes, and they literally call it a pizza box. It's 975 doses, and those vials, there's actually 195 vials. Even just in the last 24 hours, new information has come in that has made this such a different experience. We're learning, and our sites have actually had this happen. We're getting not 5 doses, we're getting 6 and sometimes 7 doses. So it's really changing things. So I start with that to say that, wow, the information changes in every single day, new information is coming out. But how did we get here? So first of all, amazing teams. It's teams of teams. We have a pharmacy and logistics team. They're already capable of receiving materials and doing things in this way, working with freezers, understanding timing, moving things around, but it's been putting those teams together and understanding the scale at which we're doing it. So each site is getting tracking information, so that's become really important that we all have visibility into that. Back in September, we actually procured those freezers, and we shuffled inventory around, and we made sure that we knew where our freezer capacity was, and able to work then with the state to understand that. And so we have the planning for distribution started. The other part is we've also had our researchers literally tracking the trial data, understanding what's happening with the vaccines, because we needed to prepare our caregivers to have the information they needed to make decisions, and really that has been a positive path that team's been working on. It was so important to build trust in the science and research along with the plans. So, and even today, our morning calls, we run these huddles, and we're tracking needles. This is the first time we're needing the mask needles and our PPE. So at least we've had this year of understanding how to locate and move very quickly and when we have not enough of something. But I will say that it is impressive how many pieces are in this puzzle and how they come together at a local level and all the information coming from different places. I didn't even mention the security team. I mean, just the security needed at our delivery sites, understanding that we had extra people like roaming around. It's really, really interesting to manage all these deliveries and the distribution. And I'd go back and say it's the team of teams. If there's one thing that we were able to do is you identify who has ownership and those teams are working together and creating transparency across the process.
Recognizing that Providence historically has done amazing things because of this team of teams concept, what were some early challenges or unanticipated barriers that arose? Despite the best of intentions, the best of planning, what was something that threw you?
Well, I think I'll answer this a couple ways. So first of all, across 2020, the biggest challenge we've had has been misinformation and conflicting information at the variety of levels. You know, my heart goes out to some of our local leaders trying to manage the different messages from the state and the Department of Health and the changing requirements for testing or whatever it might be. So we're spending a lot of time just trying to understand the information and what is truly accurate and what's changing. So we have to have a process to sort of get that communicated and the facts understood. So we had to create these two-way communications, really good listening systems, and be able to have that ability to understand and communicate across the system. And that's the power of really being this system to learn so much. I have a great anecdote. Just yesterday, the head of Alaska was able to tell us about the first vaccine where there was a allergic reaction of sorts, and so that information we were instantaneously able to spread and make sure all of our sites had that information. So those two-way communication tools have been so important through the entire 2020, and I think that the barrier that you asked, like what was the barrier? It's like, how do you prevent misinformation and get the right information out? I'd also say that across our population, the other unanticipated barrier is that we have 230,000 caregivers working for Providence or our family of organizations, and doctors, nurses, volunteers. Understanding who they are, where they are, and being able to communicate with them is a pretty large task. And so that challenge was figuring out the right ways to learn and pull that together, because that's what's been so important in this last week, to identify our high-risk caregivers and get them in for the vaccine.
Sandy, speaking of high risk, can you tell us a little bit about how you define risk in this healthcare worker population?
Oh, absolutely. So when we think of work locations, we're talking about areas in which COVID-19 patients and patients under investigation are routinely receiving care, or areas where materials, equipment, linen are routinely handled. And so that's for work location. That's what high risk. Medium risk in work locations would be where there may be patients qualifying for that. And then low risk is where it would be unlikely. And then I'd also tell you, when we look at role, we did the same thing: high risk, medium risk, and low risk. And for role, we were able to say if your role has extensive direct COVID-19 patient contact, or you're in an environment or cleaning equipment that has COVID-19 materials routinely handled, that puts you in high risk. And so what we've done is really taken the high risks of the work location, the high risks of your role, and that's essentially become our highest risk group of caregivers.
Incredibly intentional and thoughtful. Thank you for that explanation.
No problem.
What were some of the ways that you did identify and then ultimately effectively communicate with them?
Well, this has been my life, I think, for the past couple weeks here, and I'll tell you that we have put a lot of thought into it. So really taking great minds at a local level all the way up through the system level, and really had the right discernment to make sure we had a process, an algorithm to understand who our highest risk individuals are. And those individuals are essentially first in line, while also balancing that we have a surge going on, and they've got to actually keep our patients safe, and we need coverage over that. So how do you manage all that? It was a designated process of really evaluating and prioritizing based on work, location, and role. So we took those 226,000 and we identified their work location and their role, and that was rated in a risk factor. So if you're in a COVID unit, that was high risk. If you're a respiratory therapist, that was high risk, and put those together and created that ability to look at our population and be able to then sort. We did an interesting model to do that at what we call this vaccine geo level. So we were able to say, we know we're going to have vaccines at this location, so instead of just doing one hospital, we'll take all 5 hospitals in that area and we'll merge them as a vaccine geo and be able to prioritize in groups for that area. So that's been a really positive model to get us through that. And we did something super unique that I'm proud of, but it was also lots of heavy lifting. We built a validate and verify tool. So while we have this system that says your work location is X and says that your role is Y and that those had a risk score to them, we knew that in this year of 2020, people have moved, people have gone into a different, literally, I'm no longer in this city, I'm in this city helping or doing things. So how do we make sure we have the right information? And we went to the caregivers and allowed them to update, validate, and verify, as well as give us the primary communication mechanism, which is that cell phone to be able to text them. And that's allowed us through this process to really capture who they are and get communication.
Sandy, now that you've had some early experiences, what advice do you have for your health system colleagues as organizations roll out their own vaccination plans in the coming weeks and months?
I would definitely say my advice, or what I've experienced, is you have to learn your way forward by doing, and that we have been able to take on these ways in which information's coming in and help create that transparency, give folks the understanding of what's ahead, and most definitely listening and responding. I mean, there's a few things that Providence has done that I really think make a difference. We have heard that we have caregivers that, well, I've got to come in on my day off to get my vaccine, so we're able to compensate them for that time. We've done a variety of different things to be able to really hear what the concerns are, address them, and respond. So I would tell my peers, work on your listening system, because that's what makes us create the best support system for everyone.
What is a recent win that you can share with us from the last few weeks as it relates to vaccine efforts?
Wow. I think the biggest win is that we actually have vaccine in hand. So we have to give, we have to be grateful for the science that really got us here. But I would also say for Providence and our family of organizations, I look at the win in this collective problem solving that has been able to allow us to move forward. I think we talked about team of teams, but it's also just working together and really rallying around solving something. We are actually leveraging Twistle. It's a sophisticated automation, multi-channel communication platform. This is something that we've been using with our patients. It's a clinical care system. And we were able to really problem solve and say, why not use Twistle for our caregivers? That's how we can notify them, verify, get their consent or declination. We're able to then schedule and track, and did you get Moderna, did you get Pfizer, like all of that piece. So we're leveraging Twistle as that delivery engine where we're communicating and managing, and really appreciate the bright minds at Twistle as well as Providence that have spent countless hours building this pathway and making sure we're able to really look at the solution end to end. And it's been great. It works over text and email. And as I was sharing with my colleague earlier, over 60,000 of our caregivers have begun the process, been invited. And we have some pretty unique statistics. I mean, of the highest of the highest risk caregivers, 96% are saying, yes, I'm ready for the vaccine. We have about 55% that have been able to schedule already. And now we're just managing, schedules, because you have people actively managing surge and trying to get into schedule. Our vaccines are appointment only, and that's been a big change. All the mass vaccinations we've done in the past, those we're not done with the scheduling of appointments for each of them. So it's a new system. And I have to remind everyone, this is a 2-dose series, and we're just one step through. So I've got to learn our way forward to make sure that we are getting folks in that 17 or 21 days from now back into the right appointments at the right time.
Thank you so much, Sandy, not only for all the amazing work that you and your teams are doing at Providence, and as well as for speaking with NEJM Catalyst today. Thank you.
You're so welcome. Thank you.